I'm Muriel Bowser. I'm the Mayor of Washington, D.C., and I'm providing an update on the district's response to COVID-19, particularly how we're activating our community in response to this virus, how we are flattening the curve and preparing for a medical surge in Washington, D.C. So let me start by one simple message, that we are asking everybody to be a good neighbor and stay at home. Stay at home. Today, or actually yesterday, we had the unfortunate circumstance of announcing the district's second death related to COVID-19. We continue to keep families who are affected by this disease, particularly those who have lost loved ones, but also those who are recovering, and those who are on the front lines of the response. And as we ready ourselves for an increase in cases, this weekend I visited 2 healthcare sites along with Dr. Nesbitt, and what we know from those visits is that our public health leaders, our doctors and our nurses and all the administration of our healthcare systems are doing everything that they can to prepare for this crisis. Hospitals are already bringing in testing in-house, and so for anyone that is anyone who has a clinical need for COVID-19 are touching base with their doctors and their healthcare providers to have those tests done, and focus on hospital workers, certainly, and first responders in our system. DC Health and HCMA are leading the effort as well to find and activate and prepare for use, if needed, bed space outside of our local hospitals to prepare for any surge in demand. Over the weekend, I also approved the activation of the DC Medical Reserve Corps. And this evening, volunteers who have registered will begin preparing for how they can assist with the district's response. Yesterday, I directed MPD to work with the DC National Guard to restrict access to the tidal basin. And my message to residents of D.C. and this region and visitors continues to be to stay at home. We love, of course, our cherry blossoms. The festival organizers several weeks ago already canceled all of the activities related to the cherry blossoms. The trees are indeed beautiful. We've been enjoying them for more than 100 years, and we will enjoy them again next year. So stay at home. You will not be able to get access. You will not have restaurants or bars or restrooms. There will be no museums to stop in to take a break. So enjoy the cherry blossoms from what the blossom organizers and the National Park Service have put on the internet this year. I also want to thank all of our local businesses that continue to find new ways to help. Particularly, I want to acknowledge and thank all of our restaurants and restaurant workers who have switched to delivery and carry out. I had the opportunity to stop in at a local business in Petworth just yesterday, and I was certainly buoyed by their sense of optimism, but also duty to continue to serve their neighborhood in these altered conditions. I also want to thank other businesses who have raised their hand to help, like a local distillery, Republic Restoratives, who is helping us to produce 1,000 gallons of hand sanitizers that we can make available to our frontline government workers and first responders. Still, we know we need more help from the federal government. In order to have more tests available, we need more swabs, personal protective equipment, and ventilators. The White House must ensure that the nation's capital, actually anywhere in our great nation, that we have the ability to do testing or provide life-saving care. And that we can do all the logistics and planning, but we need a centralized procurement and distribution of these life-saving supplies. We also continue to call on the Congress to get to work, to continue to look at relief that is not only focused on the right now, but the long-term recovery of our nation. We know that our hospitals and medical providers need an infusion of cash in order to keep going. We also know that our workers need relief right now. So getting cash in the hands of Americans is what is required. We also know that we will have to turn back on our economies very soon, and how people get back to work and industry gets back on its feet is going to be important to our long-term recovery. I just want to reiterate the importance of staying at home. Everything is closed, and so we want people to stay close to home. We have also increased our monitoring and enforcement of our public parks. As I indicated on Friday, we have locked and closed all of the parks and recreation facilities that have locks, and we continue to see people doing group exercise, basketball, soccer, and the like. We will continue to ask our enforcement agencies to be on the lookout for this type of activity and to disperse. It is critically important that we work together to blunt the curve so that our very precious medical facilities can be used for those who are most in need. So with that, I'm going to ask members of my team to provide updates. You'll hear from Director Chris Rodriguez, who is the HCMA Director, Dr. LaQuandra Nesbitt, who leads DC Health, and then we will be available to take any of your questions.
Thank you, Mayor Bowser. I'm Chris Rodriguez, Director of the D.C. Homeland Security and Emergency Management Agency. I wanted to touch on some of our planning and preparations for what the Mayor talked about in terms of medical surge. And in many respects, we've been doing this for the last several weeks, but we do have some updates. In terms of, as the Mayor mentioned, we have seen an increase in cases in the district. Last week at this time, we were at about 17 cases. We're now at 116. So as we prepare, as the Mayor said, for an increase in cases, we're looking at medical surge along really 4 key lines of effort. The first, which has already been completed by Dr. Nesbitt and her team at DC Health, is to work with hospitals to begin to shed load by discharging non-acute patients and canceling elective surgeries. And as I mentioned, Dr. Nesbitt and her team have been very proactive in reaching out to our hospitals to make sure that we are decreasing the number of patients in hospitals to prepare for medical surge. The second line of effort is expanding space in existing hospitals using a combination of regulatory waivers and using traditionally unlicensed spaces like hallways. And DC Health, again, under the leadership of Dr. Nesbitt, is making progress in doing that throughout our hospital system. The third line of effort is reconfiguring existing facilities, like whether it be furloughed nursing homes or unused hotels, to, again, prepare for medical surge. And at this time, we, along with DC Health and other district agencies, are scouting locations and facilities to prepare for surge. And the fourth line of effort, which really hinges on our federal support, as the Mayor mentioned, is to look at opening larger facilities if need be. And we have been working with FEMA and the U.S. Army Corps of Engineers, which is in our EOC, to begin looking at planning and logistics support that the district might need if we were to open a large facility. Just want to reiterate what the Mayor had said before turning over to Dr. Nesbitt, which is to be a good neighbor and to stay at home if you don't need to be outside. And that's consistent with our efforts to flatten the curve. So thank you. And with that, I will turn it over to Dr. Nesbitt from DC Health.
Thank you, Director Rodriguez. Today we want to be able to share, as the Mayor has done, and reiterate our condolences for the passing of the 2nd District resident on Saturday evening, March 21st. The patient was a 65-year-old female who was admitted to a local hospital with fever, cough, and underlying health conditions several days prior to their passing. They were previously tested prior to the 21st, and their test results were known to the D.C. Department of Health and had previously been reported out as a positive case. As you all know, the district, since our first reported positive case of COVID-19 in the district, we've had 116 residents test positive. I'd also like to report, however, that we've had 17 residents who have been cleared from isolation and are considered recovered from COVID-19 in the District of Columbia. These are uncertain times, and our thoughts and prayers are with the families who have lost loved ones to COVID-19 here in the District of Columbia, in our nation, and across the globe, and with those who have been impacted and are recovering. And we know that we will experience more cases, and we want everyone to stay home so that more of our cases will recover, and that the number of individuals who will be impacted will be blunted in the District of Columbia. In order for an individual to recover, they must have 3 days without symptoms, respiratory symptoms, as well as no fever without the use of fever-reducing medications. And they must also have 7 days pass since the initial onset of those symptoms. And that's how we determine if individuals recover. We also want people to be reminded, however, that as individuals recover, it is still critically important that they practice the same social distancing measures that we're asking everyone to practice in our community at this time. So being removed from isolation still requires that individual practice those great social distancing practices, as well as continuing to cover your cough, being able to have good hand washing practices, and all the things that we know will to continue to keep us safe as a community. I also like to take this opportunity to underscore another important item that Mayor Bowser mentioned, and an asset that links very closely with the items that Director Rodriguez mentioned, which is our Medical Reserve Corps. The Medical Reserve Corps, the D.C. Medical Reserve Corps, is designed to support public health and medical emergency preparedness, response, and recovery. And it's a tool that we have that recruits, trains, and deploys medical and non-medical volunteers to assist with planned events and emergencies, such as the one that we are experiencing now. The D.C. Medical Reserve Corps is open to medical and non-medical volunteers over the age of 18. And it's whether you are retired, active in your profession, a community member, or a student, we need your assistance in the D.C. Medical Reserve Corps. All volunteers receive free training and a chance to work with the government and non-government agencies, and the opportunity to support their community during emergencies and public health events. I do want to underscore that only properly licensed, credentialed, and trained health professionals participate in clinical-related activities during these public health emergencies, and all other volunteers who are non-clinical participate in activities such as logistics, data management, and community outreach and engagement related to the public health activities. We have received over 1,600 individuals' applications for the Medical Reserve Corps since its activation. And we hope to have more people who are interested and have been seeking volunteer activities and ways to be engaged with the district's COVID-19 response. And if you want to have more information, you can visit coronavirus.dc.gov or dchealth.dc.gov/MRC for more information and to complete an online application. So we look forward to your continued support and working with us collectively under Mayor Bowser's leadership to have a successful response to COVID-19 here in the District of Columbia. Thank you.
Thank you. And I would like to note that we are also joined by Dr. Jennifer Smith from the district's Public Health Lab and our Crime Lab as well, and Deputy Mayor Kevin Donahue. We can take questions. Yeah.
With all your encouragement to stay at home and the emphasis on that, why not order a stay-in-place or shelter-in-place directive?
What we know is that we have basically closed down the district, so the gathering places where D.C. residents can go have been shut down. And we want to make clear that we want people to go out for essential activity, but they are going out to grocers and to procure the things that they need, and going out should go out in their immediate area with their immediate family for social distance, if they're social distancing. So that's where the district is. We will, however, continuously review any businesses that we think don't adhere to those practices and issue additional guidance. Yes.
Mayor, at least beginning when the weekend began, I was hearing from people from District Protective Services that they didn't have personal protective equipment from the city, and similar complaints from the D.C. Department of Corrections, with the correctional officers saying that the only things they had were, I guess, some gloves. They have only gloves and a mouth mask. What about the protective equipment for city employees who have to, let's say, work in these areas?
Well, Sam, what city employees that we're focused on, not just D.C. government employees, but the first responders and medical staff. And what we know, and according to all of the guidance that we've received, is that the folks who need that equipment are providing medical care. And that is how we are triaging the distribution of that equipment.
Can we get some idea as to what the situation is at the jail? There are 50 people. I've heard different numbers, 65, 50, but people are quarantined at the jail.
Sure.
What's the situation
over there? Let me
ask
Kevin to provide an update.
There was a U.S. Marshal at the Superior Court who tested positive for COVID-19. Based on the very preliminary assessment of who was in the same room as that individual, 65 inmates at the D.C. jail were quarantined, which really means sent to a separate cell block, each given their own room. When that contact tracing was completed, it turned out that there was the 65 went down to, I believe, just a handful of individuals who in fact had any kind of interaction with that individual. So the number at one point was 65. When we learned more information about who that marshal came into contact with, it went down to a handful of individuals.
So what's a handful, 10 or less?
I can get that after, but I believe it's less than 5.
Less than 5 people are still in isolation.
And I don't know if they're still in isolation at this point. As we learned more about that person's interaction, it turned out that individual for the U.S. Marshals had less and less confirmed interactions with any members of any inmates of the D.C. jail.
Also, an issue the other week when we were with the police was about the number of people that are locked up. Has that decreased at all, or can you give us any information on that?
We work closely with the judges at Superior Court and the U.S. Attorney's Office, as well as the CJCC, which includes the Public Defender Service. A number of steps have been taken on the front end to reduce the intake coming into the D.C. jail. So MPD has discretion, it has had discretion to issue citations in lieu of arrest. In other words, someone still has to come to court and they have to schedule that court date versus getting arrested right then and there. And the chief has directed officers to make robust use of that discretion. Second, the U.S. Attorney's Office makes decisions about who to prosecute based on who's arrested. They have agreed to make those decisions much earlier in the process. So prior to anyone going to central cell block, the U.S. Attorney is indicating who they're going to no paper or not prosecute. And that has reduced the inflow into the central cell block by 40%, so a significant number. There are still crimes that have to get, individuals will get arrested for, violent crimes, domestic violence accusations, and the judges at Superior Court are now, when they make arraignment decisions, which they're doing, I believe will start to do remotely, they will factor in the fact that we have a pandemic in determining who should be held pretrial. So there is a lot of work happening, and as the science sort of directs all parties, we'll continue to look for adjustments that make sense.
So you took the step yesterday and today of closing down the area around the tidal basin because of crowding.
are you at all concerned that the next day that's nice, which there's going to be nicer days later this week, that you're not going to have the same problem at other facilities across the district, both on the federal side, could be the Arboretum, could be Meridian Hill Park, but also local DC parks? And then second question, what powers, if any, do police have to actually disperse crowds? Can they write tickets? Can they take any sort of kind of more aggressive enforcement action if they see big crowds of people?
We're going to direct not just the police and the National Guard, but our park rangers and other DC personnel that we still have to help move along crowds if we encounter crowds. And, you know, the crowds could be people playing. I saw a pickup, it looked to be a pickup soccer game on a school field, for example. So we think there are a lot of different opportunities for people not to follow directions here, but we are going to ask our teams to move along people who are not practicing social distancing.
And just a question about the fact that there's going to be more nice spring days to come. Like, how do you actually stop people from going out and congregating and doing what they did at the tidal basin if you're not imposing stricter measures like a shelter in place?
A shelter in place would still, people can still congregate with a shelter in place. And what a shelter in place says is actually that you should never leave the house. And so what we are telling people is to stay at home and only make essential trips and only get exercise and fresh air with your family. And just like we were able to do with the tidal basin, even though anybody who's familiar with the tidal basin knows that there's not a gate. There's not a fence all around it. And so in order to really restrict people's walking access, you have to figure out a way to loop off a really big expanse of area to keep people from walking in. We also know that it created an opportunity for people just to go take to the street, if you will. So now they're not walking around the tidal basin, but they're riding bikes and walking. And I think they start out probably with the right idea that they're going to social distance, but it's too many people doing that too. So don't go down on the closed street and use it as if it is an open street for what you're doing. Just stay away from the tidal basin, because too many people have the idea that they can social distance from others. It's too many people. That's why we have closed it, not just right on top of the tidal basin, but for blocks beyond it.
Yes, Mayor. Yes, Mayor. Just kind of curious in terms of the reconfiguring the existing facilities, sort of the unused hotels. How many are you looking at, and what's the need for beds and for space? Just kind of quantify it.
Well, let me just say that we have a medium-term plan and worst-case scenario plan. And our teams at Health and HCMA are very actively working on what it would take to get facilities up in the medium term to deal with a medical surge if the hospitals cannot handle it. And you've heard kind of our priority. First, looking at unused space in hospitals, and we have several hospitals where that is the case. I'll tell you, for one, at the United Medical Center, we have a floor that we're looking to engage and to have operational. There are other instances like that at hospitals around the city that we are gauging. We have some empty facilities that are private. That we're also looking to engage to see what it would take to get them back up and operating, and there are at least 2 of those. And then we are at the same time planning a worst-case scenario if we need a mass new facility to be opened.
Therefore, can you say what those 2 empty facilities are, and what's the medium term, and what's the worst-case scenario, to kind of give readers and viewers a sense of like what we're looking at in terms of your medium-term planning and your long-term and your worst-case scenario?
Well, I don't want to talk about the 2 additional facilities at this point, but when we are able to, we'll share that information with you. I think that and I don't want to guess on the number of beds that the medium term would provide at this point, but I could say I'm going to ask Chris to talk about just the range of what those medium term numbers are.
So we're not going to talk about numbers right now because the modeling, we're still getting data in, right? So FEMA and the U.S. Army Corps of Engineers, we have the CDC working on modeling for us at this time to try to anticipate what we might need in the future. So I think it would not be accurate to give you numbers at this time because, again, the data is still coming in and we're still crunching the numbers. That said, as the mayor mentioned, we've already and Dr. Nesbitt has mentioned, we've already taken steps. Our medium-term plan is to, again, shed load, which we've done, and to look at expanding space in existing hospitals, which DC Health and Dr. Nesbitt have done as well. So we've already taken a lot of steps to prepare for surge, and then as our modeling comes in, and if we have to scale up, we'll be prepared to do that as well.
Mayor Bowser, you seem not want to go to the step of ordering a shelter in place. What about how close are you? When do you think you might order non-essential businesses to close? Are you at that point yet?
We are constantly examining business functions that we think can adhere to the social distancing requirement, and there could be additional guidance coming out about those. As soon as we have a good assessment.
And then on two other issues, one, the tax deadline, you see the federal government has extended to July 15th. What are you going to do about local tax extension of deadlines? And have you given any thought about people are complaining that they're still getting parking tickets and other jurisdictions have suspended parking enforcement? So
I expect that our tax deadline will be extended to coincide with the feds. There was a question if we need to update the law to do it, but I expect that to be extended, and we'll confirm that with everybody. And I think we're pretty relaxed on ticketing now. I'll check in with the team to see what types of tickets are being given. But let me be clear. Don't park in handicapped spaces, bus zones, don't park in the bike lanes, and egregious parking is still not allowed. So to that extent, you could still get a ticket. So be mindful of because we need our vehicles to be able to move, and we still need people to be safe when using the road. Yes?
Could you give us an update on the number of ICU beds available and ventilators available?
Let me ask Dr. Nesbitt. Okay. Can we follow up with you about those data points? Yes.
Getting back to the hospitals, what are they saying they're needed? You mentioned swabs and ventilators. What else are hospitals saying they're needed? And are they feeling a little overwhelmed in any way, or are they prepared for the surge?
We are in constant communication with all of our hospital providers. The assessments that we have in the district are similar to what you hear nationally. As Director Rodriguez mentioned, we have gone through phases with our hospitals and healthcare system leaders. They have taken the critical and essential steps of eliminating non-essential healthcare services and elective procedures. And so they're in a really good position as it relates to the current admissions in the hospitals and healthcare facilities, and volume in the emergency departments is down. That being said, we all are facing challenges across the healthcare delivery system and public health, and as it relates to our ability to quickly implement high-throughput testing sites that would not have limitations on them because of the access to personal protective equipment and laboratory supplies, including swabs and reagents. So all of our healthcare systems are reporting those same challenges, just as the mayor has highlighted in her remarks that we are facing those challenges as it relates to the supply chain and assistance from the federal government.
Mayor, I understand that you've now opened homeless shelters 24/7. Is that correct?
Oh, yes. So during the day, yes, they continue to remain open during the day hours.
So they don't have to, I guess, walk
right.
the
So in
streets
low barrier shelters, frequently in most of them, their hours. So during the day, the residents go different places: job training, libraries, day center services, so that they have the opportunity to connect to more services throughout the city. We have eliminated that requirement during the public health emergency, mostly so that. For the same reasons, we're trying to contain people in the locations that they're familiar with.
Now, the back to the tidal basin area. So, are people allowed to walk on the mall at all, or what's the deal there?
You are allowed to walk on the mall. You're not allowed to have a pickup kickball, soccer, or any other congregation on the mall. And we are also encouraging you not to congregate with people outside of your family unit. Yes.
A couple of data point questions. One on first responders. I'm wondering if you can update us on number of firefighters and police officers who have tested positive, but also the number of firefighters and police officers who are currently self-quarantined.
Okay, Kevin will do that.
For MPD, there's currently one MPD member who has tested positive, and based on the analysis of contact as of this morning, there's one police officer who is being quarantined as a result of interaction. That contact tracing will continue today. But as of right now, one positive, one quarantined. For fire EMS, there are 118 individuals who are quarantined. And I believe 7 members who have tested positive. I want to highlight that not all 118 are quarantined as a result of interaction with those 7. About a third of them, about 40 of them, are quarantined based on interactions they had off duty. About 80 of them are, in fact, based on interactions they had on the job with one of the 7 individuals who tested positive. And again, that's information that as we go throughout the day, we update as more facts come in. But that's what I have right now for you.
Could I just clarify on the MPD, because on Friday you were at 70, and I know you distinguish between quarantine and self-quarantine.
There's a list MPD keeps of individuals who are basically showing signs of the flu that they keep every year, not just COVID-19. So they want to know how many people are sick as a result of illnesses they did not get on the job, so not an injury. And that number is about 80. The problem with that number that we gave last week is that when I said, well, how many are quarantined of those 80, or how many are self-reporting that they think they have it, and it really, the numbers are pretty consistent with prior years. So now I've asked to Chief Newsham to indicate how many are really quarantined, either for interaction with a member or interaction off duty, and that number right now is 1. But we wanted to really distinguish that because it gave, I think, the false impression that this one police officer somehow has resulted in 80 people being quarantined.
Well, I think it gave the impression that there were 70 officers who were not on duty because they were, for whatever reason, self-quarantined.
There are
80 officers now who are not coming to work for whatever reason, health-related?
Yes, and that number is about 15% higher than last year. So it's pretty consistent with end-of-year flus and allergies. So, and again, that may change tomorrow or this evening, but that's what I have for you right now. And hopefully that gives some more clarity that you can look into the numbers with.
Thank you.
Having any impact on crime? Is crime down because of this thing?
It's too early it's too early to tell. I mean, judging from a week or two, if you ask me in 2 more weeks and there's some sustained trend, then I'd give an answer. But it's too early looking at a week or two of data about trends that we think might be sustained as a result of people being more careful with their whereabouts and with their bodies.
The last I saw, one D.C. jail inmate had been tested, and that test was negative. Do you know if that's accurate?
That's accurate.
And have any more been
And
tested?
that was a test as a result of a travel concern. So it's an individual who had been in a country that for which there was a widespread COVID-19, and as a precaution was tested, and the test came out negative.
And have any more been tested since then?
No, and as the D.C. jail has a health clinic inside the jail, and they have regular visits with the inmates. And as of right now, they have deemed the medically to only test that one individual, and that was a negative test.
What's the number right now in terms of people who have tested positive?
116.
Two questions for Dr. Nesbitt, if you don't mind. Would you mind giving us details about the 65-year-old woman who passed, how she contracted it? And the other question is, other jurisdictions have been sort of discouraging people with mild symptoms from getting the COVID-19 tests because the tests require the PPE equipment. Do you see us reaching that point in D.C., or have we reached that point here?
So we've provided all the details we're going to provide related to the case. As it relates to who accesses COVID-19 testing, doctors decide who gets tested. So we've encouraged anyone who presents with symptoms who is not experiencing, or who has symptoms who is not experiencing a medical emergency, to contact their healthcare provider. Healthcare providers have established the protocols that they're going to use to screen their patients and determine if their patients should come into their healthcare facilities for testing, or if they are implementing other modes for testing. Some may have deployed a in-home testing or a mobile testing, as the mayor mentioned. We have visited some mobile testing sites this past weekend. So that's where we stand in the district for determining who gets tested. I will say that as public health responses to pandemics go, as pandemics or impacts a particular jurisdiction, it is not uncommon for an approach to be taken where clinical diagnoses are made. We have not reached that point in the district. However, we may have to provide that guidance in the future.
Dr. Nesbitt, I'm wondering if two things. One, do you have any geographic data, like a breakdown by ward? Are there clusters? We see data from states that break it down by counties and whatnot. So I'm just wondering if you're seeing anything geographically. And then when we see these tests with a lot of young people who are testing positive, children and people under 40, 30, down to 8 years old, are they asymptomatic when they test? And what do we read into these numbers of ages, if anything?
We are unable to draw any definitive conclusions about the ages of individuals being impacted in the district at this time. There's still a lot that we are learning about the impact of COVID-19 on particular age groups in the district and in the U.S. in particular. We also, due to the number of cases that we have at this time, are unable to provide any public data around geography of where cases are in the District of Columbia. It is something that we will monitor and we will continue to monitor. However, I can confirm that we do not see geographic clusters upon my review of the data.
Mayor Bowser, could we ask about you mentioned you visited 2 healthcare facilities. Could you name those? And then just what is the mood? What are you saying as far as stress on staff? Just anecdotally, we're hearing from patients who say, staff are rude and they seem to be less than compassionate. And I'm wondering if maybe just what you were seeing anecdotally. And
well, we and Dr. Nesbitt has done more of these visits and actually been inside of the hospital and ERs. We visited together 2 mobile sites that Children's Hospital and Kaiser Permanente are putting on. And Children's Hospital will release more information, particularly about testing children and healthcare workers, which is their focus. And Kaiser, their doctors referring to the mobile sites throughout the region, Kaiser members.
And just your thoughts, maybe Dr. Nesbitt's thoughts on the stress, on just the personal interaction between patient, caregivers, and patients.
Well, I certainly will turn to Dr. Nesbitt to respond to that. But I think everybody is stressed. I think that the healthcare professionals are certainly feeling a lot of stress as they prepare And I think what Dr. Nesbitt has seen and reported out to you when last we spoke was that the shedding and that the demand on the ERs and other elective procedures in the hospitals and ERs is giving the staff the time they need to prepare in the case there is a medical surge. But I think also that they're very focused because they recognize the need to conserve PPE and to provide medically necessary care, and that includes testing. So as everybody recognizes and understands, those interactions is very important, and that everybody is taking advantage of the alternative ways to see your doctors, including telemedicine, including calling them to get advice. That is going to make the very precious hospital resources available for those most in need. Yes.
So in cases where a doctor were to recommend to someone that they self-quarantine or self-isolate or whatever term you want to use, is there a system by which the government, the Department of Health, can track these people to make sure that they're doing that? Or is it basically honor system, like we trust that you're going to listen to us on this one?
There is not a system where we have to track people.
Yes, Mayor. Just kind of curious in terms of the measures over the weekend to control the crowds at the tidal basin. When did you realize that the crowds were forming and ignoring social distance? And what was the communication with the Park Service and Park Police over how to handle it? And when did they decide to use D.C. Police to set up the roadblocks?
I decided to use D.C. Police. The D.C. Police work for us. The Park Police work for the Park Service. On Friday, I had a conversation with the Secretary of the Interior. I let him know that we were updating our guidance on parks and that we wanted to see restricted access to the tidal basin. And I think that they made some changes with vehicular access on parking and the like, and made those announcements, but people still flocked to those sites. And we just realized when we were going to have another very good weather day that if we were going to stop, even though we've canceled the parades, we've closed the restaurants, the museums are closed, the trees will still bloom as they do every year. And people from not just D.C., but all over the region were flocking to that location. And the measures that we employed are pretty extraordinary. We do not police national parks. So for us to use our local police resources to basically police a national park is an extraordinary use, but we thought very necessary.
Saturday. So when Saturday you decide that you wanted to use the police? Like early on in the day, just to kind of...
No, it was probably in the evening on Saturday. Yes.
So just to take this hypothetical a step further, I mean, the Arboretum has dogwoods. Those eventually bloom. That usually crowds not only the Arboretum, but the neighborhood right next to it where people are parking. I mean, is there a chance that you want to, do you talk to the Interior Secretary about that possibility?
I didn't talk about the Arboretum, but we plan, actually, it may be happening right now, to have a more global discussion with the national parks. The city administrator and members of our team are doing that, maybe as we speak. Thank you. Yeah. Mm-hmm.
Getting back to sort of the non-essential business closures, I mean, so Governor Hogan is ordering that right now. Can you go back a little bit to that? Are you considering that?
I've already covered that.
Any comment on Attorney General Racine publicly urging you to order shelter in place?
The Attorney General hasn't been involved in the emergency response, and I don't think now is the appropriate time for politics. Anything else? Thank you.